Hi guys, we're going to do a quick tutorial, basically just talking about needles, syringes, basically some different sizes of IV bags, and just pretending we're in a hood in a sterile environment. Everything's been cleaned. I want you to look up horizontal and vertical hood sterilization. Of course, you'd be gowned and donning your scrubs, and you've already scrubbed, sterile scrubbing with your iodine, so you're allowed to just use your bare hands in your IV hood. That's where I'm going to be, but for right now, we're just trying to make this happen. With chemo, you will be working with gloves, so I will have gloves in lab for you to have on and try. Basically, we're going to be using furosemide. It's going to be 40 milligrams in 4 mLs, or 10 milligrams per ml. You know for your calculations by now, always break everything down to 1 ml. That's where you want it to be for your doses. But that's what we're going to use. I've put some coloring in it, so we're going to talk about that just a little bit. Alcohol swab, different syringes ready to go. Okay, so these two syringes I'm going to hold up and show you are, they're BD brand name. They're 3 ml syringes, so they do measure in up to 3 ml. Their gauge is the difference. So right here, you're going to see this one is a 23 gauge needle, and this one is a 25 gauge needle. 25. Which one is the bigger needle? The 23 is bigger around. So garden hoses are like 2. The lower the number, the bigger the gauge. The smaller, the finer. So for injections and everything, I use the 25. You'd use the 23 or smaller if you're pulling up oils. That does make a difference. Okay. And then we also have, this is a 3 ml, but it's called the vanishing point syringe. And I'm going to open it and just show you. This is another one you do a lot of immunizations with. So I'm just going to show you proper. Use your 2 thumbs and you split the end here. And you use the whole part of your thumb and you're going to grip it and you're going to tear away from it. So you keep it sterile filled, elbows close together, sterile filled, and this comes out. You do not touch the plunger or anything other than this area that you're working with here. I'm going to go ahead and remove the lid. As you can see, this is pretty distinctive. There's the bevel. I need to put it behind something. See how there's like an angle? It's pointing up. Now it's sideways. It's pointing up. When you look at it, you want to see like the length of the needle is on the bottom and the short is on the top. That's called bevel up. And that's how we're going to enter our vial. So I'm holding it between my fingers, always keeping it pointed up into the airflow. I open my alcohol swab. I take the swab and I clean my vial. And just for fun, I'm going to use, this is what we use a lot of chemo bags and make your pre-treatment of your chemo. I've drawn some out of this, but this is a 100 ml bag. And this is the port they'd hook up to the IV. This is what we're going to go in and out of. This is our access port right here. So we sterilize that. You always keep that lane open in the flow. So here are my 2 items. I'm going to try to keep them closer to me. To enter my vial, I'm going to go ahead and pop my syringe loose a little bit. See how my stopper moves back and forth. I'm going to take out 1 ml. So therefore I'm going to put 1 ml of air in. I've got my bevel up. I enter the center of the stopper and I kind of angle. Did you see? 45 degree. And I catch the tip and then I'm going in. That keeps it from coring. Now there's air in here and I want to make sure my needle is totally submerged. So I slide it back so I know I'm underwater. I'm going to push the air in and go ahead and draw that solution back. And I put some coloring in so you can see it. Now it's pretty thick and heavy, so I do push the remainder of the air back into my vial, extend it a little bit lower, and it drips down, sorry, I'm trying to make it so you can see, into my syringe. Now, well, I've got some extra in there. I tap my syringe getting any air bubbles that might have stuck down here out. You can pull those all the way back, give you some working air. Sometimes if you've got a bunch of little bubbles, that's very helpful. And then I push it back, and as I measure it, I'm going to slide it up so the black goes to my 1, and that is going to be my 1 ml. To enter my port, again, bevel up into the center of the hole, and you push down. A lot of times this is hanging, so it's a lot easier in your hood. And it goes through 2 different ports inside, so it's kind of tricky to make sure you get it all the way in. And then as you inject it, we've got food coloring so you can see it go in. This comes out. And after you inject it into someone, like if it's in their arm, watch, I'm pushing the button. The needle is retracted. It's a safety needle. So it is gone and is stored inside here. Don't need a sharps container for that. That's great to use when you're doing mass injections and immunizations, not an IV hood. Okay. Something that then you put, like, there's a little plastic thing you put over this, you label it, initial it, and send it up. Okay, going to our needles. This is the lure lock system. It unscrews and opens up. So when you attach it, it just lure locks in and out. Your needles can also come this way. Again, to open a needle, you fan it a little bit to separate the sides. It should just pop right apart, and it's not going to, because there we go. Can you kind of see that clear? Again, thumbs totally in, pushing with your fingers, and you're going to just peel it open and hold this back. Outside of the paper is not sterile, inside is. Do not expose your field. Goes right in, lure locks in, and I now remove that paper, and I don't even put it down my hood. I throw it in my trash can. Never touch the surface of your hood. This is a much longer needle. This is a 1.5 inch needle. Again, bevel. I've got it facing up right now, trying to put it where you can see. Not, now it is. Don't recap syringes, I'm just doing that to protect myself. Again, as you draw it back, as you can see, the increments on it. The 2 is a circle that it's marked. It's just trying to standardize and make it easier for care, all the way back to 3. You cannot use this for over 3 mLs for dosing. All right. This is basically your sodium chloride 0.9% or normal saline, and it is a 50 ml bag. This is another common one. It would hang in and you'd work with it. And then your liter, this is your 5% dose strips, and your 0.45 comes in a bag. When you're in the clean room, you tear it open. The bag never enters your sterile space. That's just one way to keep it sterile. Of course, you always clean all your ports with your alcohol. To put an injection in a bag, for example, I'm going to jump down to, so you can read it better. This is an insulin syringe. I'm Sure Comfort. On it, it says 310 cc, but it also gives the units. And it says 30 units or less. So that tells you the measurements on it. And then also, this is the 8 ml needle, or the length of the needle. And it's a 31 gauge, so it's really tiny. 3 things that talk to you about the syringe: the volume, the length of your needle, and your gauge. Okay, so on the syringe, it's actually in units. Of course, this is basically 3/10 ml, which is on back, so it's not a full ml, or it's 30 units. So if they're measuring like 2 or 4, this is a small syringe you can get to use that. As you can see, the needle is itty bitty. I don't even know how to show you that. Tiny little needle. Okay? So when you draw back, it's very small. Okay. So to enter your insulin vial, you do your 45, catch it, flip it upside down. There's so little in this, so I'm going to go ahead and draw it up to 15 units. Basically, I'm going to have to use my vacuum a lot, so I'm going to overdraw more to pull it in, and get past my 15. And I'm going to push it back up and make sure all the air is out of it. There's no air. You can tap it, and if there is one, then you just push it up a little bit. To inner bag, especially with this being so small, push on the back of the bag. So therefore you get your fluid and everything up around that port. Sorry, you can hardly see it. Slide that in. Very tender needle. I don't know if this is so hard. And it goes in. I know you couldn't hardly see that, but it did go in. And as you mix it, it goes into your bag. So the key on that was just pushing your end open. You don't have to ever recap your needles in your hood. You have your sharps box, you just throw them right in. Usually it's a massive box. And so there's that on how to enter the bag.